having a full audience in the house. I have to apologize for the title of the talk today because it's really somewhat of a clickbait. As a healthcare provider, I truly believe that we should actually stop educating patients. We should stop using the term patient education and at all costs avoid patient engagement. I'm Eran Kabakov, the CEO and co-founder of DaCola, and I've been a healthcare provider for over 25 years. If there's one thing I've learned is that healthcare is 20% procedure, 80% communication. And when I tell that to my colleagues, they get mad at me because it somewhat belittles the effort and time they put into going through school and what they're doing. But think about a healthcare encounter. How much of it is really treatment versus explanation? Now, I went to physical therapy because I wanted to help people feel better. And early in my career, I was super proud at my extraordinary ability to heal people with my hands, right? They would come to me, they would be in pain, I'd do something, they go, they feel a little better. But I quickly realized that the patients I was communicating with, that I was sitting and informing about what's going on, were doing better. That was a little painful for my ego. But that realization made me very passionate about patient education, so I started researching and learning about the whole concept. And just having said that, the question that I pose is, why am I standing here saying we should stop doing patient education, being that I'm so passionate about it? Well, before we get into that, let's look at the history and the definition of patient education. One can argue that patient education has been around forever, since people have been helping other people. But when you look at the research and the text, there's two figures that come into play about coining the term. The first one is this lady, Florence Nightingale, who obviously was a huge force in medicine, but was a firm believer in sharing information with other healthcare providers and patients. And she was very vocal about nurses becoming educators. Then something else happened before I introduced the other person. In 1953, the VA released the first bulletin with patient education as part of that bulletin, saying to basically letting the hospitals know that they should do patient education as part of their treatment. But it didn't become a main practice. And in 1971, this guy releases a letter to Congress saying that health education should be part of healthcare. And he appoints a committee that comes back with the instructions on how to do it, and suddenly patient education is discussed as something that should be done, and the whole study or field of patient education comes into action. So what is education? It's the process of facilitating learning. It can take place anywhere, and it has a formative effect on somebody by how they feel, do, or act. And that's important. So a survey asked healthcare providers, what are the obstacles for you to educate in the practice? And these are the results. Don't read it. It's impossible, right? I'll show you in a second a summary. This is an image of the same survey asking patients, what are the obstacles for learning in healthcare? Right? And I put them side by side for us. So the first point on the screen is time. Both providers and patients are saying they don't have time for patient education. At this point, I should do a mic drop and just leave the room, because if there's no time on both sides, then why are we even trying? But for the sake of education, providers are saying that they're not sure how to do it. They're not getting paid for it. They don't have space in the clinic to effectively do it. No skill. It's a low priority. Patients are saying that I'm too stressed to learn. It's too complex. I'm not feeling well. It's too complex for me to actually get this concept. There's no space. I don't feel comfortable getting the education in the clinic, right? I need space to actually learn. And of course, literacy, which I left for the last one, because anytime you look at patient education, literacy comes up as the biggest obstacle. So, you know, I'm a healthcare provider. It's like, what can I do to do this better? There's no way. This is an impossible scenario, right? Completely, absolutely impossible. So what's the alternative? I say the alternative is care communication. So you say semantics, patient education, care communication, what's the big difference? Let's compare the two. Patient education in nature is paternalistic. I know, you don't. You know, you come to me, I'll educate you. That's first thing. So it's not great for the relationship. The second thing is generic. Go into most hospitals, most clinics, the information that you're getting is very basic and it's repetitive. You go here, you get the same information, you're going to go there. It doesn't really do anything for the relationship that we have as healthcare providers and patients. And quite honestly, I can just go on Google and get all the information that I need. You know, so why do I need you, the healthcare provider, to give me this pamphlet? It's like, you know, we're living in a new age. So that's a big part of why patient education, you know, we know it's failing, but why we shouldn't do it. What is care communication? What I'm saying care communication should be is throughout the care, it should be throughout the care continuum, right? And communication happens naturally. We talk as it is. Now, healthcare providers, I know there's a couple, right? If I look at you and I say, think about your classic patient, and think about the two questions you hear all the time. Do you know them? And people say, yeah, I know them. What do you say? Well, this is what I say. So as healthcare providers, we already have the answers that patients usually want and need. You know, the question is, how do we deliver them effectively to support healthcare and outcomes and you know, value-based medicine and population health and all that. So, okay, I'm a physical therapist, I'm in the clinic, and I'm faced with this, okay, I want to communicate better. You know, what kind of tools can I use to do this? And I'm starting to look, and I just wasn't sure. So I found a few tools that I communicate with every day in life, right? All of these. I already do this. I can share information with my friends and family at any point, a mass of information, however I want. But when I step into the clinic, there's issues that come with these services. There's privacy, HIPAA, right? Integration into EMR, all those obstacles that are happening with these services. So I hypothesized with my partners and team that we can create a technology that will emulate what these services are doing and enable us as healthcare providers to change the way we communicate with patients. So we created a platform that enables healthcare providers to aggregate information from any source. You can go to YouTube and you can pull out information from YouTube. And just as an aside, I saw a survey by Accenture that said that 3 out of 4 nurses point patients to YouTube for patient education. And I'm thinking to myself, as a healthcare provider, it tears me apart, because basically you come to me for service and I say, oh, you know, YouTube has great information about how you can get better, right? Like, okay. But you can still bring the videos that you like into the system from YouTube, and you can bring your PDF, you can actually make your own videos, and you can create a course that supports the clinical and business flow of your own practice or organization. Then you prescribe it to a patient. So we are now creating an individual connection between the patient and the provider. The patients can share the information that are prescribed that's prescribed to them with anybody else that they want to, and we track all of that. And we report back to the healthcare provider so that they can iterate and make the communication better, improve it, and increase everything else. We've also done something very different and that you don't see, and we've put a version number on all of the content in our system. So every time you upload something as a provider or create a course, there's a version. And that version then is changed when you iterate. So when we give education, when we give medications to patients, there's a lot number on the box. Why don't we have a lot number on the communication that we do? Well, now we do. So we surveyed, we had 70,000 users use our technology, and we asked them. Now, these are the problems that we had with patient education. We wanted to see how the technology compares to the issues that they described here. So 32,000 surveys came back to us out of this total group. And what we found was that 98% satisfaction across the board, both providers and patients. Great. 96% of the patients were better prepared for whatever it is they were facing, whether it was a procedure or just general ongoing care. 92% came back for the education, for the information that they were getting from the providers online. And what's the most interesting to me was that there was a mistrust within our providers that they weren't sure they're going to, patients going to like it, that it's going to work, that they knew how to do this. And 95% of them came back and said, you know, no, it actually works really easy. You know, all I have to do is just put my message and share with patients, and it works. So that was, again, as a healthcare provider, it was nice to see because I wanted them to, I wanted to improve the care in general. This is just a quick case study. It's a surgeon in Buffalo, New York, a hospital-based bariatric surgery practice. 2 surgeons in the practice, very heavy volume. They have 1,200 patients, which turn into 500 procedures a year. This is a screenshot of the video he's using to share with his patients. Now, what I want you to look at is the background. You know, it's got like this, I think on top, it's his grandkids' picture, you know, that they made. It's on the top. It's not snazzy. It's not flashy. What it is, it's genuine. This is how, you know, this is how we communicate in personal life there, right? If I want to show somebody, like people, you know, taking videos right now, they're posting it things. It's not, doesn't have to be like this shiny production. It's about, this is what I do. This is how I want to help you. This is what's going to happen, you know? And then you ask the patients, does it work for you? And they say, yes, it works for me. Or if it doesn't, then you go back and you iterate and you make it personal and you make it relevant. And actually, I'm going right into my next slide. You know, I'm here basically saying we should do care communication, right? And care communication means that it is personal to the patient, personal to what it is that they're going through. It's relevant, which means that it's right here, right now, but it can be when I'm making the decision of what procedure I need or what medication or where should I go and everything else. It's self-published because honestly, if I pick you as a healthcare provider, I want to know what you are going to do. I don't want to know what this company is going to tell me that you're going to do, right? Tell me what you're going to do and be concise about it, right? Out of, again, videos on YouTube. Any video on YouTube under 60 seconds, so 59 seconds, will be viewed to completion, regardless of the content. That's a true fact. So, you know, we can keep our education to be concise and precise. I challenge the healthcare providers here tomorrow, Monday, to look at your care communication materials in the office and see, you know, is that how it is? And if not, make it so, and for the patients in the audience, share it with your healthcare providers. I'll take questions. Thank you. So we created a marketplace within the system. It's an open marketplace. Anybody can bring materials into it. We basically have an agreement that controls the intellectual property of all the content. So anybody that brings content into the system maintains their IP, regardless if they're a healthcare provider or a professional. So it's actually, if you upload video to YouTube and you use the common creative that licensing that. Yeah, no, we're not, yeah. So it isn't. If somebody posts something on YouTube and they're plagiarizing, and you bring it in, obviously YouTube has an issue with plagiarizing. You can stream for education purposes. You can stream from YouTube. So we don't download from YouTube. We just stream YouTube directly. And there's this whole other thing with the government that you have to sign up to be, legal with that. So we're doing that as well. Absolutely. We're asking the patients. That's what we do. So every piece of information that is provided to the patients on the system has a direct feedback opportunity, and patients are actually giving feedback. They're saying, this is great, or this point is not clear. We wanted to make it easy and take the academic aspect of education, because again, you look at the survey, that's the obstacle, right? The healthcare provider is saying, I don't know that I'm doing it well. I'm like, you are. You're at bedside, right? When the patient needs, what do you say? I say that. Do they feel better? Yes. Well, say it and see if it works. And if it doesn't, then change and try again. I don't think there's a perfect solution for it, but I think that we can do better than what we're doing today. Yes. Hi. Thank you. Yes, sure. So from our experience with our prototyping and everything else, that was a good question that we were asking. We know that the technology can scale up and be pertinent or effective in personalized medicine. So that if you want Mrs. Smith to learn how to prepare her insulin, you can just bring your phone up and video her right into the system and make an individual course for her, right? As far as sharing the information, I mentioned the marketplace. What we're hoping to see is that healthcare providers that are good at making content, it goes back to your question, healthcare providers that are effective at communicating, uploading content into the marketplace so that other providers can use those bits of information in the general course. Because if you remember, again, I was saying healthcare providers can aggregate information from any source, so they can utilize other providers as well, right? We have a mind share. That's something I tell when I meet with hospitals. I always say, how many providers, healthcare providers, you have working here? So let's say they say, 500. I'm like, okay, how many years of education are in those 500 minds, right? How much knowledge is encapsulated in those minds? What are you doing to taking that knowledge and sharing it with patients? Nothing today, because there's no way, and it goes back to your question of scaling. We can pull all that knowledge, put it out there, and share with patients. Yeah. So today, it's manual, unfortunately. And the main reason is, when you look at patient education materials online, they're not tagged in a way where AI can actually approach them. So one of the things we're doing is when people are uploading content into our system, we're starting to tag, we're starting to use tags. So if you're not a healthcare provider using information for your own materials, if you're a content provider, we basically make you put an ICD-9, ICD-10 codes that attach to the content, so that later with AI, when a doctor says or a nurse says, I want to educate about this, they just put the code and they have a slew of information. So that's going to come, yeah, for sure. Anybody else? Okay. Thank you very much.